Crisis Response Incorporated. Before the break, Dr. Ossip, we were talking about how this kind of comprehensive mental health crisis and addictions treatment service is pretty rare. In fact, what I have read is that the program here in Baltimore is seen nationally as a model program for crisis services. One of the things that occurs to me is that when you begin to look at all the concern that there is, especially these days with the economy and the high cost of medical care and treatment, that when we look at psychiatric care, there's also a pretty big price tag that goes along with that as well. Are there economic advantages to operating this kind of crisis service for people in the community?
Absolutely. When we talk about patients needing a level of care where they would need to be in a residential program, our residential unit is really an alternative to an inpatient hospitalization, and we're all very much aware of the very high cost of inpatient psychiatric treatment. So our crisis residential unit is an alternative to that at a much lower cost. It is non-hospital based, so there's an elimination of all the associated hospital costs. And ours is a short-term unit where we're looking at a crisis model with very assertive case management and very intensive treatment in a short period of time. So I think we're not only cost-effective, but effective in terms of psychiatric treatment.
Now, so our viewers can get a sense of how this might play out, is there a particular case that comes to mind that you think of in terms of how it was and why it was that a crisis care approach worked effectively for someone that you worked with?
Well, there have been so many cases over the past 12 years that I've worked with Baltimore Crisis Response that have struck me, but one that we worked with fairly recently was an older Caucasian male. I think he was in his early 70s. He'd always lived independently and worked. But recently his eyesight had been declining due to age-related macular degeneration, which is fairly common. And unfortunately, he had to utilize all his financial resources to pay the copay for his eye surgery, which saved his eyesight. But that resulted in him having no resources left for housing, for rent. And obviously he was not able to work any longer due to his declining eyesight. So this older male found himself homeless. He approached his family members to assist him with housing, and unfortunately his family rejected him, and he found himself in one of the homeless shelters in Baltimore City, which was very frightening to him. Being an older man with very poor eyesight, needing to take all these eye drops for his eyes, and he actually presented to one of the local emergency rooms in Baltimore City, acutely suicidal, really at the end of his rope, as it were. And the emergency room, luckily for him, contacted us. A team went down to the emergency room to evaluate him, and we found him to be a very good candidate for our crisis unit. And we brought him into our crisis unit and were able to stabilize him psychiatrically. And then we were able to do very assertive case management, which I take a lot of pride in, because we were able to go beyond often what even an inpatient hospital unit can do. We were able to assist him with some financial resources that he was not aware of, help him get some additional benefits. And then we were able to link him to a care provider situation where he can get supported housing in a fairly nurturing environment. And really his story was very heartwarming because we were able to intervene with someone who was acutely suicidal, help stabilize them, and then link them to ongoing treatment. So
now let me ask you a question. I mean, how long did that take?
He was with us approximately 2 weeks, which is a little bit longer than our usual length of stay, but given all the additional resources that we had to bring into play for him, I think that was not an unreasonable amount of time. And
so you're telling me that here's a guy that is essentially homeless and destitute on the street. He's despondent, he's suicidal, and Baltimore Crisis Response was able to come out, see him, take him in, get him psychiatrically stable, and then get him the kind of supports that he needed to live relatively independently in the community. I mean, he was in a supportive housing situation, but he was still in the community. He didn't have to be institutionalized.
Yeah, absolutely, I think. And we were able to restore his self-pride, and give him a sense of hopefulness about the future, and that he could be a worthwhile member of society.
That's quite a story. You must take a great deal of pride in doing the kind of work that the organization is doing.
Absolutely, and really I see myself as part of a multidisciplinary team. None of us do this alone. We all work together as a team, providing psychiatric interventions, social work interventions, case management, nursing, and all of this happens within a framework of a team.
Now, one thing that I also understand and I think is an important part of this organization that you have a leadership role in is that Baltimore Crisis Response Incorporated also works with the police department and does some training of police officers. Can you talk a little bit about that?
Yes, Baltimore Crisis Response was very in the forefront of training police in terms of behavioral interventions, training them to become more sensitive to mental health issues so that when they're confronted with individuals in the community, that they've got some knowledge and background as to mental health issues and how to intervene in those situations to eliminate or minimize violence, rather than arresting consumers, steering them more in the direction of mental health treatment.
And this is extremely important because police, as you know, are often the first responders when there's a behavioral emergency. I mean, the people call the police because the police come. People call the police because families and community members are frightened by the kind of behavior that people are exhibiting. So what you're saying, in essence, is that police officers are trained so that they can be more knowledgeable, more sensitive, and use words rather than force to help people in a mental health crisis.
Mm-hmm. Yeah, this training has helped to de-escalate situations where the police are called. And then with the knowledge of our services, they're able to call us as second responders to a situation where we can help to continue to de-escalate and perhaps do an evaluation, bring those patients or individuals either into our crisis unit or help facilitate them getting to the local emergency room for a mental health evaluation.
So the teams are able to, after the police arrive and do the appropriate level of intervention, de-escalate people, then the teams can come out and do an assessment and see if the individual is appropriate for a community setting.
Absolutely. Mm-hmm.
That's an extremely important partnership. My understanding is that at this point we've trained about 300 police officers, 50 sheriffs, and a number of the downtown partnership street monitors, the people that kind of patrol the street and help ensure safety. Okay, so Baltimore Crisis Response does lots and lots and lots of things. it's an extremely important organization. Is there anything that you can think of, kind of some final thoughts about the role of Baltimore Crisis Response? Do you think that they're going to continue to be around in the future?
Absolutely. I think that with the crisis that healthcare is facing in this country, really this is a model of providing mental health treatment that is effective, cost-effective, non-traditional, and definitely should be a wave of the future.
So when you think about this organization, it sounds like they really are on the cutting edge, that it's an effective use of taxpayer dollars because it is a private nonprofit organization. They're meeting people, seeing them in their homes, street corners, community settings. I understand they go to shelters. They work with the police. It's quite an effective organization, really something for you to be proud of.
Thank you.
Okay. Well, we're close to time to having to wrap up, but any final thoughts about the role of this organization in terms of the future of mental health services?
Well, I think that Baltimore Crisis is very effective in eliminating or reducing the waits and the crowding in emergency rooms, trying to divert people from emergency rooms and also from inpatient treatments, which tend to be more restrictive. I think using our crisis residential unit, our crisis beds, and also the in-home model of treatment is very effective in terms of the whole totality of mental health provision of services.
Well, I want to thank you. Thank you for your work and your dedication. Clearly, this is a service that's needed, and I hope for the community that these services continue to be funded and also that the funding increases. And I want to remind our viewing audience that if you or someone you know needs help with a mental health or addictions crisis, to call Baltimore Crisis Response at 410-433-5175. Remember, your mental health matters to us. Thank you.